So you probably think that I'm stupid or boring and I don't know what I'm talking about and I'm totally just embarrassing myself right now, which are all totally thoughts that people with social anxiety might have as they're engaging in a presentation and talking to the camera or talking in front of an audience. So this video is going to be focused on social anxiety and the specific evidence-based strategies that I use with patients to really help them to feel a bit more confident and reduce their anxiety in social situations. If you don't know me, my name is Dr. Parky. I'm a clinical psychologist, and I've been studying and practicing evidence-based mental health for the better part of a decade. I love talking about all of these things, so I'm just sharing that with you here. So let's first of all talk about what is social anxiety. Social anxiety really fundamentally is a fear of negative evaluation of other people. So, being worried that other people think that they're boring or stupid, and it can span a lot of different possible situations. Like in some cases, it can be presentation focused, like maybe talking in front of an audience like this. It can be related to unfamiliar social situations like going to parties or meeting strangers or talking to authorities or eating or drinking things in public. All of those things can be related to our fear that other people are sort of thinking poorly of us, or that we're worried that we're going to embarrass ourselves in front of other people. And how social anxiety disorder differs from normal shyness, because obviously everyone's going to be a little bit nervous about presenting in front of 500 people or, having a conversation with an unfamiliar person, is its sort of impact on our functioning and our distress level. So for people with social anxiety, the distress is significantly higher than expected, in sort of other typical circumstances where, a person might never go to parties because they're so worried about sounding stupid in front of another person or meeting an unfamiliar person, as well as its impact on our functioning. So someone might kind of skip their French presentation because they're, feeling like, I don't want to sound stupid in front of other people, and they'll take a 0 on something worth 25% of their course. So as you can see, the amount of impact on their day-to-day is quite substantial, as well as in terms of frequency and duration. So this could be something that really spans a lot of different situations, as well as lasts quite a long time. So in the diagnostic criteria, typically to be diagnosed with social anxiety disorder, it takes you have to struggle with it for at least 6 months or more. So it's a, pretty substantial part of your overall picture throughout your life. So the gold standard treatment for social anxiety disorder is cognitive behavioral therapy, and CBT has a little fun model that helps us understand how CBT works in theory, which is there's a situation, and then there's kind of a cascade of thoughts, behaviors, emotions, and physical sensations where, let's say the situation is going to a party and talking to someone, a stranger, and the thought is, I'm going to totally sound, embarrassing. I'm going to not know what to say. And the physical sensations is like, feeling like really tight in your chest, really kind of shaky. And your emotion, of course, at the time is quite anxious. And your behavior might be to either avoid the situation altogether, or, maybe look away and try and end the conversation ASAP, or drink alcohol, or bring a close friend so that you don't have to talk to anyone else. All of these are kind of like the cycle of the CBT model, where fundamentally our focus is to work on some of the thoughts and work on some of the behaviors to get you out of this anxiety trap and get you back on track. So as you notice from some of the examples I provided in terms of behaviors, they're all different ways to sort of avoid the fear consequence of being evaluated. So one of the strategies, of course, unsurprisingly, that is very powerful in treatment of social anxiety as well as other anxiety disorders is the use of exposures and sitting with the anxiety rather than running away from it the moment you notice it. So in this context of exposures, you can really start small and do something that is just a little bit anxiety provoking, and then make your way up the hierarchy. So you might first of all start by just talking to your Uber driver, or going to, a nice small gathering with friends or acquaintances that you know. And then as you kind of continue to build up, you might go into bigger parties, or, have a sort of bigger conversations with people, with friends, or maybe ask out that person you really like. So you can kind of notice that it's kind of like graduated, built up on top each other, rather than immediately jumping into the danger zone where it'd be really hard to like jump in with all of your, faith and trust, where you can kind of build up that confidence using these lower level, lower stakes exposures, and then making your way up from there. And when it comes to avoidance and exposures, avoidance, as I noted, isn't always sort of the way that we think about it, which is like we don't do the presentation, we don't talk to the person. There's actually more subtle safety behaviors that people can engage in to do the thing kind of without really getting the full benefit. So someone engaging in exposure, by talking to a stranger might do something by, drinking a couple glasses of wine just beforehand so that they can feel a little bit more socially lubricated in the situation, or they might kind of end the conversation as soon as possible, or they might like look away so they don't have to like look at the person's face and worry that they're bored already. So as you can imagine, all these things might help reduce anxiety in the moment, but they maintain the overall fear that the other person doesn't like them or they're going to be negatively evaluated. So if you're engaging in exposure, you want to be mindful of these little safety behaviors that you might be engaging in that takes away from the great work that you're doing. And a more unique type of exposure, and one that I often do with patients to actually surprisingly good benefits, is something called the video camera exposure, where we're essentially recording ourselves as we present something or have a conversation with somebody. And the reason why this is really helpful is that it actually provides us direct evidence towards how we are performing. Because when we have social anxiety, we almost have this sort of third perspective video camera that we kind of see ourselves in, where I'm walking in a room and I feel so awkward, or I'm talking right now, I'm probably stuttering and, like everyone can see I'm shaking. And then when they actually look at the camera and review their work, they're like, oh, okay, well, yeah, like I didn't do so well in this area, but I wasn't as shaky as I thought. I wasn't as red as I thought I might be. And that sort of additional evidence can actually provide sort of evidence against our sort of observer view or hypothetical imagined self, and actually can be quite helpful. And alongside this sort of observer effect, people with social anxiety are also inward focused. Like we're actually really focused on, how we're thinking about things. What should I say next? Am I looking like I'm kind of embarrassed and feeling beet red? So you're almost like focused completely on yourself rather than on the other person. So one thing that can be helpful to experiment with is almost this opposite action, where instead of like focusing all on my own internal sensations and my thoughts and what I say next, you kind of turn that attention outward and focus on the other person. Listen to what they're saying, listen to or look at their facial expressions. So really focusing on the other person rather than towards inwards towards yourself, which is actually going to make it harder for you to, naturally think about the next thing to say and really listen to what the other person is saying. And from a more cognitive perspective, it is of course helpful to tackle some of the thoughts that you might have that kind of impede your ability to, socialize. For example, one of my patients had the thought that, people don't understand me because English is not my first language. My first language is Hebrew. And, I'm going to sound stupid and people will kind of push me away. And as we kind of evaluated the evidence of the situation, I was even able to bring, my own thoughts, which is like, I can understand you very well. And I think you're kind of charismatic and humorous. And, in different conversations, when he's had to go to the bank and, provide instructions, he was able to do well and support his dad through that process. So there were a lot of evidence to suggest that he could still be his funny, charismatic self, even in English, even though, of course, we want to honor the fact that English is not going to be as comfortable and he's not as good as English compared to his, native language. So you might do the same. You might identify some of the scary thoughts that you have and see if they actually correspond to reality. Does it actually make sense? Is there a lot of evidence for that particular thought? Or there's some contradictory evidence that at least helps to lighten the thought so that we can honor where it may be true, at the same time honor where it isn't true, so we don't have to get stuck with this really powerful, all-consuming, scary thought. And for some people, it might be helpful to continue cultivating their overall social skills, like learning how to kind of provide open-ended questions, to validate the other person, to engage in sort of more indirect, active listening skills, like being able to, make eye contact for a little bit, being able to nod and smile and kind of engage with the other person. So if that's something you're struggling with, that might be helpful to slowly practice in small components. So in some cases, you might ask an additional question, ask an open-ended question, be willing to share just a little bit more about yourself, continue making that eye contact. All of those things might be helpful to slowly build up that ability in order to, make sure that it's not just the sort of cognitive behavioral components that need to be addressed, but also really making sure that you're as strong as possible as a communicator, as another person in the social conversation. And remember, although anxiety can feel quite isolating, one thing that is helpful to know is that most people want connection. They want somebody to be able to talk to them, to understand them, and to validate their experience, both in terms of their pain as well as their successes. So, people aren't necessarily these foreign aliens that want to be fully disconnected from the world. People want these type of connections, and you being able to take that first step could be the start of something that really grows into something really awesome down the road. So hopefully this video was helpful, and I'll see you in the next one. Bye-bye.